All right, well, I'm going to dive right in. Thank you all again for being here, for sharing your lunch with me during this time. So my presentation today, the impact of breast cancer on sexual health. Breast cancer does not take away your sexuality. This is going to be 90 minutes of information you maybe have not heard yet in your breakouts, maybe a little bit of info that double dips from what you've learned from your breakouts, but not as much in depth. So I'm just trying to encompass everything. So let's dive in. I want you to save one bite of food. If that means there's something on your plate you want to save or you want to go grab a dessert, but save one bite of food because we are going to do an exercise with a bite of food. So make sure you shimmy it aside on your plate. We're going to talk about three different women in this presentation, and we're going to start with Sarah. Actually, I'm going to share the women first, and then we're going to go through. So Sarah. She says, I have no sexual interest. If I didn't have sex for the rest of my life, I'd be fine. She's a 38-year-old heterosexual married woman, breast cancer, status post total abdominal hysterectomy, and bilateral salpingo oophorectomy. Next is Nancy. Nancy says, we haven't had sex in 5 months. It hurts too much. I'm desperate. She's a 49-year-old heterosexual married woman, breast cancer, status post total abdominal hysterectomy, and bilateral salpingo oophorectomy. And then finally, there's Kelly. And Kelly says, I can't even look at my breasts, let alone let my wife look. I haven't let her touch me since surgery. 29-year-old lesbian married woman, stage 2 breast cancer, status post bilateral mastectomy. We're going to talk about all three of these women and how to navigate each of these issues. So if you hear any of these quotes and you think, oh my gosh, that sounds like me, then pay attention to that part of the talk because this is exactly what we're going to talk about. How do you navigate these? All right, so to get started, breast cancer and sexual health, between what percent and what percent of breast cancer survivors report sexual health concerns? And just yell out the number. Is it like between 10 and 20%, between 30 and 40? What do we got? 99. 50 to 90. Okay, are you ready? It is between 70 and 90%. I mean, it depends on the research study you're looking at, but almost all women with breast cancer have sexual health concerns. And I mean, this is why you're here. I'm sure this is not a surprise. And here's the deal with sexual health concerns or sexual dysfunction. Sexual dysfunction does not get better over time unless it's treated. So if any of you have thought, well, the sexual pain or this dryness or my difficulty with orgasm, it'll just take some time. It'll get better. It won't. It will not get better over time unless it's treated. And there absolutely are treatments. So what do you do? And this is what we're going to talk about. First of all, I want you to remember as we go through this whole presentation, breast cancer does not take away your sexuality. Things are going to change, things are going to be different, but it does not take away your sexuality because there are treatments for the sexual health side effects after breast cancer. Now, here are the most common sexual health side effects. These are all the ones we're going to go through today. Low sexual desire, sexual pain, poor body image, and avoidant sexual dynamic, and we're going to go through each of these in that order. So we're going to start. We're going to talk about how to treat them, and then how do you navigate your sexual relationship within these. And let's start with low sexual desire. And this brings us back then to Sarah. Again, she says, I have no sexual interest. If I didn't have sex for the rest of my life, I'd be fine. So what do you do? Well, first of all, we've got to talk about the two different types of sexual desire before we can talk about what Sarah can do. The first type of sexual desire is called spontaneous desire. And that's that type of desire where you have that internal drive, that internal craving, and just spontaneously you're like, yeah, I really want to have sex right now. So that's spontaneous desire. The second type of desire, which is equally important, is called responsive desire. And so responsive desire looks like this. You are sexually neutral, sex is not on your mind in any way, but the ingredients are in place that allow you to be responsive. And so maybe those ingredients are you're relaxed, you've got good energy, you're feeling close to your partner, there's privacy, like the kids aren't around, and then maybe your partner initiates, or maybe you see something sexy on television, and you're like, oh, well, I wasn't thinking about sex, but oh yeah, I think I could be open to it. And that's responsive desire. So then once the sexual activity gets started, then you go, oh yeah, this is nice. I should do this more often. So there's spontaneous desire and responsive desire. Both are equally important. We're going to talk a lot more about them. Now let me show you, and I'll have to just kind of map it out. Maybe I can use my laser over here. Will it go that far? Ooh, it does. This circular model is the circular model of sexual response. It is the way that probably most of you in the room respond sexually. It looks really complicated, so let me explain it. So basically, there's two ways your sexual response can get kick-started. You can actually kind of have desire and get this cycle started. One way is you just happen to, can you all see that? I can see it over here, but I don't know if it's playing mind tricks. You can see my pointer? Okay. So you can just spontaneously have sexual drive, and that's where you just say, oh, yeah, I want this. That's where you think, ooh, I'm aroused in this moment. Or maybe you say, I'm going to seek out some sort of stimuli. Maybe I'm going to open up a sexy book or something. So you could just have that spontaneous drive, and that's what gets this kick started. But probably for most of you in the room, it's not going to be that spontaneous desire that kickstarts this cycle. It's going to be that responsive or receptive desire. So over here, you're going to feel receptive. The ingredients are in place. What happens next is there's some sort of stimuli. If you have a partner, that might be your partner initiating. If you don't have a partner, that might be, again, something sexy on television, or maybe you've got like some erotic literature next to you, but there's something that kickstarted, some sort of stimuli. As long as biologically and psychologically everything's in check, meaning that you don't have a massive headache, you're not in pain in any way, you're not feeling super stressed or depressed, so as long as those systems are in check, first thing that happens is the body starts to get aroused. So the right buttons are getting pushed and the body starts to get aroused. Then, on the coattails of that arousal, comes the desire. Now, this may not sound important, but this is incredibly important. What I'm saying here is for most of you in this room, when your whole kind of sexual desire, arousal gets kickstarted, it needs to get kickstarted with arousal first. Your body needs to start to feel something, and then on the coattails of that, your mind goes, oh, yeah, okay. And why this is so important is I see so many couples where they'll talk about how sex gets initiated, and they'll say like, oh, well, when my partner initiates sex, they just say like, hey, you want to have sex? Like, that's not going to do it. Your body needs to get kickstarted first. There needs to be massages and touching. Your body needs to feel something, and then your mind will go, oh, yeah, okay, I think I'm up for this. So desire comes after arousal. That leads then to some sort of emotional or physical satisfaction. And so maybe that's, reaching orgasm. Maybe that's just the skin-to-skin contact, but there's something that feels satisfying about that sexual experience that leads you to feel emotionally intimate or close with your partner, which then allows you to be receptive or responsive towards sexual activity going forward. So this is the circular model of sexual response. We'll come back to this a little bit later. All right, so now, how does this relate to breast cancer? Hormones play a big role in how you respond sexually, especially in your sexual desire. And if there have been changes in the balance of your hormones, there's going to be changes in your sexual desire. And one way to think of this, if you think about spontaneous desire having a gas tank, most of the gas that fills this gas tank is hormones. And when you go through breast cancer treatment, aromatase inhibitors, oophorectomy, anything that's going to impact those hormones, that's going to take away a lot of gas in that gas tank for your spontaneous desire. The other thing that fills that gas tank is the honeymoon phase of a relationship. So if you are at the start of your relationship, where your partner burps and farts and you think it's adorable, that puts a lot of gas in that gas tank. But we know from the research that honeymoon phase cannot last any more than 12 to 36 months. And as a couples therapist, I have never seen a couple where they're still in the honeymoon phase at 36 months. It seems to really dwindle at like the 6-month, 12-month mark. But that puts a lot of gas in the gas tank, the novelty of the relationship and your hormones. Okay, so then you go through breast cancer treatment. All those things involved in breast cancer treatment, you don't have the same level of hormones you had before or not at all. And if you have in a relationship for over 36 months, you don't have that honeymoon phase, which leaves you with an empty gas tank, which probably leaves you saying, I don't have much spontaneous desire. I can't think of the last time that I just spontaneously thought I want to have sex right now. So that means that the remaining desire, which is still equally important, is that responsive desire. If you're saying to yourself, I really don't have much spontaneous desire, then I want you to really think about that responsive desire as your main desire. And if responsive desire is your main desire, then we've got to talk about, well, how do you tap into that? Now, the way to tap into your responsive desire is through something called the dual control model. This does not sound fun, but it actually is really cool. The dual control model is based on this research that for everyone, when it comes to their sexual desire, you have a brake pedal and you have a gas pedal. And in order for you to have desire, in order for your sexual function to even function, you need more on your gas than on your brake. Now, things that hit the brake pedal, common things that hit the brake pedal are going to be your body image, right? If you're not feeling good about your body image, probably hitting the brakes of wanting to be sexual. If you're tired, probably don't want to be sexual. Chemo, depression, anxiety, stress, all these things hit the brakes. Things that hit the gas pedal, your partner smells good, maybe they look good, there's novelty in the relationship, you have a strong emotional connection. Those are all gas pedal things. Now here's a really important part of this dual control model. Okay, we got this brake pedal, gas pedal. If you think about this as a car, and imagine this is a car, and you've got your foot all the way on the brake, all the way on the brake, and then you decide to put your foot a little bit on the gas. What is going to happen to your car? Yeah, like you're going to get a little revving, but it's not going to go anywhere. So oftentimes when I see couples in my office and they say, I'm having difficulty with desire, I have low desire, I'll ask, well, what have you done to try to, kickstart that desire? And they typically tell me they've done gas pedal things. Oh, we've tried date nights and lingerie and brought out toys. But let's bring back the car analogy. If there are so many things hitting that brake pedal, it does not matter if you put your foot on the gas. It does not matter how many gas things that you do. If your foot is all the way on the brake, the car is not going to go anywhere. So the first line of treatment, me as a couples therapist, my first line of treatment when I'm working with couples or individuals, what is on your brake pedal? Let's figure out what is on your brake pedal and then try to remove as much as possible off your brake pedal. If we can remove as much as possible off your brake pedal, then after that, we can start thinking about what to put on the gas. But the gas pedal is pretty irrelevant, at least at the beginning. Now, here is another model. It doesn't sound very fun, but it is really helpful. Another model of a really nice way to organize all the most common things that hit the brake pedal. This is called the biopsychosocial model. So there are biological things that hit the brake pedal, psychological things that hit the brake pedal, relationship stuff, and social-cultural influences that hit the brake pedal. And I'm going to go through the most common issues that hit the brake pedal, and I want you thinking, this is going to be an exercise we're going to do in a moment, but I want you just thinking about of all these things that most commonly hit the brake pedal, what of these might be hitting your brake pedal? So let's start with physiological, most common physiological, biological issues that hit the brakes. Chemo, yeah, if you're going through chemotherapy, you probably don't have much desire. If you're on medications, especially like aromatase inhibitors, how that impacts your sexual or your hormones, your hormonal balance, lack of hormones. Genitourinary syndrome of menopause. I'll talk a lot more about this in a little bit. I'll describe it as GSM. Genitourinary syndrome of menopause used to be called vaginal atrophy, but then doctors realized women don't want to be told their vagina has atrophied, so now we're going to change that. So GSM, but the reason why GSM hits the brake pedal is it causes sexual pain. There's drying of all those vulvar vaginal tissues, and that causes sexual pain. And of course, if sex is painful, it's going to hit the brake pedal. Anything that impacts the hormones, like I've been saying, that's going to hit that brake pedal. Fatigue, I'll ask my clients, at the end of the day, if someone were to hand you a platter of sex versus a platter of sleep, which platter are you going to take? And if they say the sleep platter, then fatigue is probably hitting your brake pedal. Most common psychological issues that hit the brake pedal, anxiety. What anxiety does is it tells you that there is a threat. And you need to be scanning the environment for this threat. If you know that you have your doctor's appointment in a couple weeks and you're going to find out your numbers, you are probably in an anxious state because there's a threat coming about. And if your body's in that threat state, it is not allowing blood to flow through your genitals. It is not allowing you to get sexually aroused, because that would be dangerous. Like if we think back in like cave people days, if there was like a lion behind a bush and you were just like, lion, I'm just gonna self-stimulate over here because I'm aroused right now, you're gonna get eaten. So anxiety helps keep you alive, but it also shuts down the blood flow to the genitals, the blood flow to get aroused and have desire. Depression. Depression massively hits the brakes, because you think about one of the hallmark features of depression, it's not feeling any pleasure or motivation or interest in the things you're typically interested in. So that really hits the brake pedal. Poor body image. If you don't feel sexy, probably don't want to be sexual. History of sexual abuse or trauma. If you have a history of sexual trauma that hasn't been processed, it could get kicked up, it could get triggered in a sexual experience. Distraction. This one is so common. So I'll ask the women that I work with, when you're actually having sex, what are you thinking about? And so often, I hear some laughs, and so often what I'll hear is, I'm thinking about my to-do list and this deadline I've got. That's super distracting and also not very sexy, so it's going to be difficult to have desire and arousal if you've got that distraction. Substance use is the next piece. A little bit of substances, like a little bit of alcohol is actually kind of helpful, but if you go beyond that, it puts a major damper on your ability for your body to sexually respond. Now relationship issues that hit the brake pedal. Conflict, if you're fighting with your partner, probably don't wanna have sex with your partner. No emotional intimacy. If you don't feel close with your partner, remember that circular response cycle that I showed a little bit earlier? The top of that cycle said emotional intimacy. If you don't feel emotionally connected to your partner, that's a huge break. Your cycle isn't able to complete itself if you don't have that emotional connection. Partner dysfunction. If your partner has a sexual dysfunction, low desire, if you have a male partner, inability to get an erection, that is going to increase the likelihood that you're going to have some sexual functioning issues. And then inadequate stimulation. If just the right buttons aren't being pushed, the way I think this is really relevant to breast cancer survivors, and Breyer mentioned this in her talk, if your nipples were a really sensitive spot that started your sexual script, and now you don't feel those same sensations, your nipples can't kickstart your sexual desire anymore, then you're probably not getting adequate stimulation. There needs to be a negotiation with your partner about other ways to get stimulated if that used to be the way to kickstart the sexual experience. Lack of privacy. So again, I asked that question, what are you thinking about when you're having sex? And I cannot tell you the number of times I've heard people say, well, I'm worried the kids are gonna walk in the room. And so then what I say next is like, do you have a lock on your door? Like, lock the bedroom door. The number of times I have heard clients say, oh, we actually don't even have a bedroom door. And I'm like, what? Go to Menards and get a door. That's step number one. And then finally, sociocultural influences, limited sex education, conflict with religious, personal, or family values, maybe societal taboos that tell you, you as a woman shouldn't be the one initiating sex. All of these things are things that can hit the brake pedal. So what I want to do, and this is where you either have a blank piece of paper in your folder, and if you don't have a blank piece of paper, your journal will work just fine. But we're going to do an exercise, and I want you to flip your paper to landscape mode and draw out these 4 columns that you see right here. So a biological column, psychological, relationship, life stuff column. And as you're drawing that, I'm going to keep speaking for a little bit before we actually get into the exercise, but basically I just want you to draw exactly what you see on this screen. And give yourself hopefully enough space to write in these columns. So what I do with the clients that I'm working with, because I mentioned before, you want to really find out first what are hitting your brakes. What's hitting your brakes? Cannot even talk about gas stuff until we figure out what's hitting the brakes. So I've got a big whiteboard in my office. For you all are going to use your piece of paper. And I'll draw this on the whiteboard, and then with my client, we'll go through everything in every column that's potentially hitting the brakes. And she might say, I've been having hot flashes and night sweats. I am not happy with my body image. My partner and I have been arguing, and I'm in that sandwich generation. So I am just pulled every other way, helping my parents and helping my kids. These may be the main things on her brake pedal. You're probably going to have a lot more on your brakes, but this is just to give you kind of a sampling of what this looks like. And then what we'll do in session, we've got a whole list of everything hitting the brakes. Then I'll ask, of all these different things hitting your brake pedal, what of these have the greatest weight? What of these can we modify, change, get rid of? Pick the top 3 things, circle them, and this is going to be the start of our treatment plan. We're going to start to systematically go through and see how we can modify and remove these brakes, and then later we'll talk gas. Because if your main desire is that responsive desire, we're really trying to figure out how can we remove the brakes, add some more gas to tap into, to figure out what are the ingredients that need to be in place for you to be responsive. Now, here is the sheet. Here are all the most common factors that hit the brake pedal, all the things that I just mentioned on that biopsychosocial model. What I want you to do, and we're going to do this for anywhere from 5 to 10 minutes. We'll see how much time we need. You've got your sheet of paper. You've got your 4 columns. I want you to really take a moment, take several minutes, and think about what is hitting your brake pedal. So start with the biological column. These are all the most common things, just to give you kind of an idea. But start writing down on your piece of paper, biologically what's hitting your brakes, psychologically what's hitting your brakes, relationship, if you're in a relationship, what's hitting your brakes, and the other kind of life stuff, sociocultural stuff, what's hitting your brakes. And again, we'll do a few minutes for this. And as you're doing this, I want you to really think about things that are hitting the brakes currently. What are things that started to hit the brakes after cancer, what were things that were hitting the brakes before cancer? Oftentimes when I work with breast cancer survivors, they'll pin a lot of their sexual health concerns on post-cancer, on cancer. And then as we dig a little bit deeper, we find out, like some of these relationship issues or some of these other pieces, this anxiety, like this was happening even before cancer. These were things that were hitting the brakes before, they just worsened after cancer. So really think about before cancer, after cancer, what are all the different things that hit your brake pedal? And while you're doing this, if you have questions, let me know, shout them out. Yes, question. Oh, yes, you were in my previous talk. Can I get off the podium? I know this is being videoed, but do you want to come up here? Oh my gosh, yes, welcome. Okay, great.
All right. My question was, from a biological perspective, are there things that are biologically more tuned into male versus female on some of the, especially physical side? This is an excuse that my boyfriend sometimes throws at me, for instance, that he is a much more sexual being anyways, blah, blah, blah. But I'd like to understand that a little bit more.
Okay, big question. I'll see if I can give some answers. Differences between men and women when it comes to desire. So what we know from the research is that men, and I'm talking cisgendered men, so we're not going to go beyond like transgender men, this is for cisgendered men. We know that they are significantly more likely than women for their main desire to be spontaneous desire. And that is likely because testosterone is a big driver for that spontaneous desire, and men have a ton more testosterone than women do. So we know that that's a big difference. We also know, and this doesn't totally answer your question, but I think it's just interesting, we also know from the research that men are a lot more visual when it comes to sexual stimuli than women are. So men are consuming porn more. If they see a naked body, they're going to find that a lot more arousing than women. This is just kind of an interesting little anecdote. There's been many research studies where researchers are trying to figure out what do women find attractive or arousing, and so they'll show women erotica. And there was one particular study that did eye tracking technology. So a woman's watching erotica on a screen, and it's tracking what she's looking at. And they did it for men too. And men are looking at all the women's bodies, and women are like, look at those curtains. What are those shoes? How is she doing that with her heels? So women are a ton more contextual. It's the whole picture. And then the other thing that I wanted to say is there's not any research that says men are more sexual than women. I think the best data we have, and it comes to some degree from this dual control model, it is not that men are more sexual than women. I think men often need less ingredients than women need, but it doesn't mean they're more sexual. Does that answer your questions? Okay, got a thumbs up. Yeah, so she just said women are dealing with a lot more besides them just being horny at that moment. Yes, kids, jobs, yes. And then, I mean, we can have an even bigger discussion about how society puts a lot more on women and the expectations of women, and women are supposed to be nurturers and take care of others instead of themselves, and like, yep. And then we can see, wow, all the things that hit the brakes for women. It looks like most people, my timer's going off, most people are done filling out their sheets. Does anyone want to share some of the brakes that they identified on their brake pedal? What'd you say? Looks? Oh, like how you look or how you... Yes. Yes. Okay, so what she's saying is looks, but specifically like feeling self-conscious, how your partner sees you now versus how your partner sees you before. Like you might be wondering, and we're going to talk about this when we get to body image. Like, are you wondering, like, does my partner not find me as attractive? How could they find me attractive? Or I've had, double mastectomy. How is this arousing to them? Yeah. Is he looking at my scars when I'm naked instead of me? Yep, and then that plays into the distraction thing, because I would ask you, what do you think about when you're having sex? And you'd probably be, I'm thinking, is he looking at my scars instead of me? Someone else said something, maybe at this beginning table, or yeah. Fear. Fear of rejection.
He doesn't want, because I do require more ingredients to get aroused. And is he gonna be like, I'd rather be watching YouTube?
Yeah. Yes. Okay. So fear of rejection specifically because there are more ingredients that are needed to get aroused. And so is your partner just going to say, this is too much work. I'd rather just watch YouTube. Yep.
And I'll go back to what she said with the image piece, but as I'm single, and so then it adds in that layer of when do you have that conversation of, listen, this
Yes.
happened, and I don't have nipples that, you can go date anybody that's potentially, absolutely 100% whole, and I'm not. So for me, it adds another layer to it to where that's big on my brain. Just because I am single and I
Yep.
don't know how to approach it.
Okay, so what she said is being single adds a whole additional layer because if you have a partner, look, when do you introduce, hey, by the way, these are all the ingredients that I need, oh, and my nipples can't be stimulated as maybe your other partners, and so then you wonder, does this person even want to be with me? Maybe they'd want to be with someone else who needs a lot less ingredients. Yeah, yeah. Yeah.
That's kind of his thing too. Like I'm married, so I know my husband's biggest thing was like winter breast or feeling something go, and his emotions like, oh my God, this is great, So the feeling isn't there anymore, and so I don't have that stimulation to get me feeling the way I need to as well. When at times where the breast would be there or something, or the squeeze of it, it's not there anymore. So
Yep.
I think that's a lot of the feelings that you're like, oh my God, how am I going to feel this? How am I not going to feel this? How is that taking away part of our sexual life? How am I going to get it back?
Yes. Okay. So essentially what she's saying is, it's like the sensations, the physiological sensations are not there now like they were before, and so just being touched and trying to feel aroused or feeling that kickstart of blood flow to the genitals, like if the sensations aren't there, like how can you get stuff kickstarted and then kind of get the ball rolling? And then also, I'm going to add this piece because I think this is kind of what you're saying too, that like, if you're feeling those sensations, if you're starting to get into it, then that gets your partner into it because they hear you and they think, oh, she's really liking this. And then that kind of just fuels everything, and to not have those same sensations, it takes a hit. Yes?
Well, even me with that, like, he doesn't understand. So, like, I'm fortunate. I have a little bit of feeling, but it's almost like a non-dull kind of almost pain.
Mm-hmm.
On my nipples, like, in my breast, they're so kind of back or whatever. And so that's a big thing for him. He wants to touch it, and I'm like, stay away from there.
Yeah.
They don't understand why we don't feel or how we don't feel or how we aren't the same way. They're having all these feelings like we're having it. Is she going to think the same way about me? Or, is she not going to, what is she looking to do now? She doesn't want me to touch that area, or she doesn't want me to. Well, I tell them. So that's what I'm saying. Like, I actually tell them.
Yeah. So let's go. So it's the understanding piece. Your partner's like, wait, why does this not work like it used to? What do you mean that these sensations aren't the same? Like, I don't get it. And then you brought up this really good point of communication. Communication is one of the key ingredients to having a satisfying sexual relationship. Oftentimes, women that I work with will say, like, I don't know what to say. I don't want to hurt my partner's feelings. I don't want to offend my partner. And so then you end up just experiencing stimulation that is not very stimulating or enjoyable. But it is so important in the moment, and you're saying this is what you do, to say, hey, this is what I'm feeling, this is what I'm not feeling. We're going to talk about at the end of this talk some exercises to do to try to enhance some of that communication. So we'll get there. I want to dive into, let me get here we go. Come As You Are. I don't know if any of you have read this book. It also has a workbook that goes with it as well. When we're talking communication, brake pedal, gas pedal, your partner learning the changes that have happened in your body, you learning the changes that have happened in your body. This is a phenomenal book. It is not specific to cancer or breast cancer survivors. It is a general book about women's sexuality, but it is hands down the best book I have ever read on women's sexuality. It will be incredibly relevant, even though it's not specific to cancer survivors. Then there's a workbook that comes with it. So here's what I recommend to the couples that I work with. I'll say, I want both of you to get the book. read the book. It's also a really entertaining audiobook. The author does the audiobook for it. Read the book, listen to the book. I want you to doing this together. Talk about the book, get the workbook, and do the workbook together. This is going to help facilitate some of those conversations about, yeah, how have things changed? What do things feel like for you? How do we navigate this new kind of sexual normal? Okay.
Like there's no explanation for men. They have to navigate on their own. It's where they have a routine. They kiss you, then they go to your boobs, and then they move on, and they're like, "What you now?"
Ooh, yeah, so really good point. Like the script is for, well, we're generalizing a little, don't be too mean to the men, but you were saying like kiss, boobs, vulva, vagina. So we need to change that script because the whole body can be an erogenous zone. We're going to talk about something called sensate focus exercises. This will be the latter half of this talk, and this will be a way to get away from that script, so we'll get there. So let me give you just a brief take home just when it comes to low sexual desire. So there are, again, two types of sexual desire, spontaneous and responsive. And with hormonal changes as a result of chemo, AIs, oophorectomy, that responsive desire is going to become the predominant desire. So if your responsive desire is your predominant desire, really think about how do you maximize that responsivity, and that's by figuring out what ingredients need to be in place. That paper that you all wrote down, your main brake pedals, I want you to really think about whether it's now or after the session today, top things. What are the top 3 things that hit the brakes? Circle those. And then how can that be modified or navigated? Can you talk to your partner about any of these top 3 things that hit the brake pedal to try to modify them? But that's going to be the start of trying to figure out what ingredients do you need to tap into your responsivity. So now we're going to go to the next one. We talked about low sexual desire. We're going to talk about sexual pain next. I'm going to get this back here so I've got more hands to deal with. Okay. All right, so we've got Nancy. Remember I introduced you to Nancy at the beginning of this talk. Nancy says, we haven't had sex in 5 months. It hurts too much. I'm desperate. So what does Nancy do? Let's talk a little bit about breast cancer and sexual pain. Breast cancer causes sexual pain through GSM. Remember I mentioned GSM a little bit earlier, genitourinary syndrome of menopause. And essentially what GSM is we have tons of hormone receptors, of estrogen receptors, and testosterone receptors too in the vulva and vagina. And when those receptors are being fed with estrogen, the vulva is nice and moist and plump, and those tissues are nice and thick, and you have good vaginal elasticity. And estrogen actually helps facilitate blood flow to the genitals. So you got good estrogen, that means blood is flowing to those genitals. What's blood flow to the genitals? That's arousal. So you're getting good blood flow, that means you're easily getting aroused. Also, that blood flow helps with the sensitivity. You got good blood flow, your genitals are gonna feel those sensations. So estrogen in the genitals are a really, really good thing for sexual function. But if you don't have that estrogen, then all those estrogen receptors dry out. And so that vaginal lubrication goes away. The skin, which was nice and thick and moist and plump, women describe that it feels like sandpaper. It thins out, it dries out, it can rip and tear. I know these do not sound like fun descriptors. The vaginal canal, which used to be elastic, more elastic, loses that elasticity, and again, it also can rip and tear with penetrative sexual activity. You have less blood flow. That estrogen is not there to facilitate the blood flow of the genitals. So essentially what happens is that it takes a lot longer to get aroused because you have less blood flow, and you're not feeling the same sensations that you felt before because you have less blood flow. And that is GSM. When that happens, that is GSM. And about half of women who have GSM report that they also have pain with penetrative sexual activities. Now, what causes GSM? Anything that's going to take away your hormones. And so for breast cancer survivors, more than likely, it's treatment-induced menopause. It is menopause that's been induced by the treatments. And those treatments, surgery, chemotherapy, aromatase inhibitors. And this is not like, this is not regular menopause. Menopause that has been induced versus menopause that you kind of naturally enter is so much worse because you have this sudden onset. All of a sudden, your body wakes up from surgery or after you've taken your meds and says, where did the hormones go? It's sudden onset. As a result, the symptoms are more severe, and they may not entirely respond to hormone therapy. And many of you probably can't even be on hormone therapy. So then what are your options for these symptoms? So this is the primary cause for pain for breast cancer thrivers and survivors. I talked a little bit already about estrogen and sexual function, but estrogen really is core to maintaining the physiological function of your genitals. And like I said before, estrogen is really helpful for your vaginal sensation, your lubrication, preventing sexual pain, promoting sexual arousal. So what do you do then if you're having painful sex? And I'm going to talk about some options that relate to estrogen. I'm going to talk about lots of options that have nothing to do with estrogen, because like I said, many of you probably can't even take estrogen. So step one, if you are having painful sex, and this is going to sound so incredibly obvious, but it is really important, stop. If you're having painful sex, stop having painful sex. And here's the reason why. Every time you have sex and it is painful, so sex pain, sex pain, sex pain, sex pain, these get connected. These get connected in your mind. So when you even think about sex, what's the first thing you probably think about? Pain. Yeah, so we need to break that connection between sex and pain, because the more you have painful sex, just the stronger you're putting that connection together. And what happens over time is, when you've got this pain and sex connected, is something called an avoidant dynamic. This is the most common dynamic I see with my couples and couples therapy. So avoidant dynamic looks like this. One partner says, hey, you want to have sex? And the other one's like, nope, that hurts, no thank you. And so after so many times of that partner saying, you want to have sex now? Nope, that hurts. Then the partner just goes, okay, you know what, I'm just not going to initiate. I'll leave it up to you when you want to initiate sex. It's up to you. And so what happens is now sex has stopped. And there are two ripple effects in this avoidant dynamic. So first thing that happens is sex stops. And then over time, that ripples to the non-sexual physical affection. So this is where one partner might say, well, really, gosh, I want to go up and hug and kiss my partner, but I don't want them to think I'm initiating sex, so I'm just not going to. And the other partner, maybe the partner with pain, says, well, I really want to go up and hug and kiss my partner, but I don't want them to think I'm initiating sex, so you know what, I'm not going to. So now the non-sexual physical affection starts to decline. And then over time, the final ripple is to that emotional connection. And this is where the couple says, we just feel like roommates. This is the avoidant dynamic. And it starts from a really sweet place. It starts from the place of like, I don't want to hurt you. I don't want to put pressure on you. You can just initiate when you're ready. But then all the onus is on that one person to initiate when they're ready, but they have pain, so they're not going to. So it starts from a sweet place. But as it ripples, it becomes actually quite damaging. And we're going to talk a little bit later on how you address this avoidant dynamic. But this is why it's so important that if you're having painful sex, stop having painful sex, because if you're not already in the avoidant dynamic, you're going to trend toward that avoidant dynamic. Step two, are there over-the-counter options to alleviate some of this pain? Or if there aren't over-the-counter options, or those over-the-counter options aren't totally alleviating the pain, perhaps there's a new sexual menu you can create that doesn't involve sexual activities that are painful. So let's talk about a few of the over-the-counter options. Breyer talked about these in her talk. For those of you who went to Breyer's talk, but I want to give you a little bit of a breakdown. Moisturizers are really helpful for vaginal pain. And moisturizers are different than lubricants. We'll talk about lubricants in a second. Moisturizers are, like, think about them as face cream for your vagina. The same way you wake up every morning and probably put on face cream or maybe put on hand cream, this becomes a part of your regimen where you put this cream on the vulva and vagina. And moisturizers are only effective in the accumulation of them, meaning that you can't just moisturize one day and be like, oh, okay, I'm good to go. It is the cumulative effect of using those moisturizers multiple times a week that traps in that moisture that gives you that more moist, plump vulvar tissue. It's not going to bring your tissue back to what it was pre-cancer, pre-menopause, but it will give you more of that kind of comfort throughout the day. Replens is a common moisturizer. It can be irritating to some people. Hyalogine is another moisturizer that's been specifically tested with breast cancer survivors. You can only buy it from the Hyalogine website, though. So those are a couple options for moisturizers. But this is something that becomes a part of your daily routine. You put your moisturizer on at night. Now, lubricants, on the other hand, are as needed for friction reduction. You only use those in the moment for sexual activity. And there are a couple different bases of lubricants. There are water-based lubricants and silicone-based lubricants. There are many other bases, but I'm just going to briefly talk about these two. Water-based lubricants, their base is water, which means that there's really kind of no contraindications. You can use water-based lubricant no matter what. I'll tell you some of the contraindications of silicone in a moment. But no contraindications to water-based lubricant, but because it is water-based, it evaporates quickly. So if you're putting it on, you may have to put it on again and again and again in a sexual scenario. You can also, little trick of the trade, put a glass of water next to your nightstand and just dip your fingers in the water and then touch that lubricant and it will reactivate the water-based lube. Silicone lube, on the other hand, super slippery, super long-lasting. You will not have to reactivate it in any way, but it has some contraindications. It is so slippery that if you were to take it and squirt it on the ground, you will slip and fall if you step on this. Also, if you have a male partner who has any sort of erectile difficulties, it is so slippery that they may have difficulty keeping their erection because you lose so much friction because it is so slippery. And then the third contraindication for it is if you have a sex toy or a sexual aid that is made of silicone, the silicone lubricant could degrade your silicone sex toys, and those toys are pricey. So if you have a silicone sex toy, you probably want to go water-based lubricant. But the silicone, you will not have to reapply. You can use it in the shower, in the bathtub. It's a long-lasting lubricant. And so these are a couple options for lubricants. Sliquid is a really great company that has organic, non-irritating lubricants, and Pink is a great silicone lubricant. Now, new sexual menu. Let's say you're like, you know what, Jordan, I've tried everything, and we can't get rid of the pain. It typically pains with penetrative sexual activity. So you might say, penetrative sexual activity is just painful. I don't feel like that's an option anymore because the pain's not worth it. Then you want to think about creating a new sexual menu that doesn't involve whatever activity is painful. That's perhaps penetration, or maybe it's a different activity. So consider a non-penetrative sexual menu. All of you, or I'll give you I don't think you have it in your handout, but I've got a link that I'll have at the end of this talk where you can download a sexual menu. So this is a sexual menu I give my couples, and it's two-sided, and each side, tons of different non-penetrative sexual activities, and then at the top is a rating scale. So 1, I'm not interested in doing this. 5, I would love to do this. So you rate it, your partner rates all the activities, you come together, you compare, and then everything you two have rated really highly can be the start of your new sexual menu. If you don't want a paper menu because you're like, oh my gosh, what if my kids find it? You can do mojoupgrade.com or weshouldtryit.com. These are online menus. You create a login, partner creates a login, and you complete the menus, and then it shows you all the things that you both are interested in. I'm pretty sure We Should Try It. That one's a little bit more advanced, but hey, maybe you're up for that. A vibrator is a great addition to a new sexual menu. For those who went to Breyer's talk, she talked all about different vibrators. I want to give you just a little snippet for those of you who didn't go to her talk. If you are thinking about a vibrator, you may be like, I am so overwhelmed. How in the world do we even choose? And I think 5 of the raffles were like vibrators, right? There's tons of vibrators out there. So how do you choose? I'm going to give you a little bit of a breakdown on how to choose a vibrator. Ask yourself, are you wanting vibration that is internal, that is external? Maybe you're curious with both internal and external. So then you're kind of thinking about like how wide is, or the shape of the shaft, how wide is the toy? I would say if you're a first-time vibrator user or like a beginning vibrator user, get one that you can do both internally and externally because it'll just give you more options and you can try more things. Here are a bunch of different examples. This one over here would be external only, that the shape of that shaft, you wouldn't be able to insert that. Plus there's like mechanical stuff in there, you don't want to insert that. This one's internal and external. Here's an internal and external. Ooh, this one does combo. You have it both internally and, so it's inside the vagina and then wraps around and also touches the clitoris at the same time. So lots of different options, but if you're new to vibrators, I would say get one more like the second one so you can use it both internally and externally and just try out and see what you like. You've got to ask yourself, mobility. Oh, we got a question, yeah. Yes, okay, so here's the question. If you have GSM and you're concerned about penetration, don't you think using a vibrator internally would probably hurt? So a couple things. It could. The shaft of the vibrator, like if it's a smaller shaft, you may be able to find a shaft that actually penetration doesn't hurt with that shaft. You could get to control the depth of that vibrator and put a lot of lube on the vibrator. So it's not a guarantee that if you have GSM and you do internal vibratory stimulation, that it's going to be painful. You can do a little bit of experimenting to see, is there a type of vibrator that might actually feel good? There's also a possibility that, nope, any sort of penetration simply does not feel good. And then don't buy the expensive internal vibrator, just get the more bullet one. So great question. Okay, so another question to ask yourself as a first-time vibrator user is mobility. If you get a plugged-in vibrator, it's going to be a lot more powerful. The Hitachi Magic Wand is probably the most powerful vibrator out there. It plugs in. But if you want more mobility, then you're going to want some that has rechargeable batteries. You're going to ask yourself, am I going to use this solo, or am I going to use this with a partner? Then if you are going to use it with a partner, maybe you want to ask your partner if they have a preference. Is it important to you that it's waterproof? Maybe the main place you're going to be using it is the bathtub or shower. There are lots of waterproof vibrators out there. Material. I don't want to get in too much of a rant about material, but there are so many different materials for vibrators. There is, let's see if I've got you, oh, I've got examples. So there is hard plastic. There is silicone. This is a medical grade silicone. This is a gel. This is cyber skin, and this is rubber. And there's also glass and steel. There's so many different materials. Here's the, this is my rant on sexual aids. Sexual aids are not FDA approved. So you buy a toy, and oftentimes it says on the box for novelty only. So they've not gone through any sort of approval process. And the Danish Environmental Protection Agency actually did testing on a ton of different sex toys, because what are these materials made out of? Are these even safe for our bodies? And they found that a lot of sex toys are made out of phthalates, which are possible human carcinogens. So you've got to just really be careful what you're buying, what you're putting in your body, because you're not going to find the ingredients for a lot of these toys on the boxes, because the FDA doesn't regulate them to have to test the ingredients or even put what the ingredients are. So here's my recommendation, and the recommendation of the Danish Environmental Protection Agency: silicone. The second one right here, medical grade silicone, or steel or glass, but that gets a little bit more advanced. I would say if you're a first-time vibrator user or current vibrator user, just get a medical-grade silicone. The website I love, I don't work for them or anything, but Lelo, L-E-L-O, Lelo.com is a great distributor of vibrators that you know are medical-grade silicone. The other thing about material is different materials call for different cleaning. So if you have a material that's porous, like the gel or the cyber skin or the rubber, they're a lot harder to clean. And so really the recommendation is if you're using any of those types of toys, you want to just put a condom on them, because it's kind of impossible to clean such a porous toy. Versus a medical grade silicone toy, soap and water. Just clean it with soap and water. Some information on how to use a vibrator. There are no rules on how to use a vibrator. Just explore. Use it internally or externally, as long as that's not painful. Use it all over the body. This is a great photo that I found. Use it solo or with a partner. And then just clean it with soap and water, as long as it's that medical grade silicone. Okay, so now let's go back. Step 1 was to stop having painful sex, because you don't want to get into that avoidant dynamic. Step 2, are there over-the-counter options that can alleviate that pain? If not, consider a new sexual menu, which may or may not include a vibrator. And then step 3 is potentially some prescription options for GSM. And I'm not a medical doctor, I'm gonna give you that warning, but I am gonna share with you what we know from the research, and I just wanna give you enough info that you can talk about these things with your oncologist. So if you have GSM, if you have pain with vaginal penetration, consider vaginal estrogen. Have a discussion with your oncologist. Some of you might be saying, Jordan, estrogen's completely off the table. I still encourage you, if you haven't had this discussion about this type of estrogen, to have a conversation with your oncologist. So vaginal estrogen, maybe I'll back up for 1 second. I'm not saying estrogen as a pill or a patch. This is not systemic uptake of estrogen. This is simply localized estrogen just to the vulva and vagina. What we know is localized estrogen just to the vulva and vagina increases pelvic blood flow, it increases lubrication, it increases genital tactile sensation. It comes in a cream, in a ring, in a tablet. And from the research we currently have, and of course there should always be more and can always be longer research, but the research we currently have is that estrogen just to the vulva and vagina, just localized, there is little to no uptake to the rest of the body. So it may not change your numbers, but talk to your oncologist. This is a discussion with your oncologist, but it is worth a discussion. So vaginal estrogen really is the gold standard treatment if you have GSM. And again, it's a conversation with your oncologist, with your doctor. There are some other options, though, that are not hormone specific, but impact the hormones in interesting ways. There's DHEA progesterone. So this is intravaginal. Maybe some of you have seen ads on television for it. There's Intrarosa as one example. These are suppositories. What these do is they activate the estrogen and androgen receptors in the upper layers of the skin and epithelium, but not other tissues. These have not been specifically tested in breast cancer survivors. But again, what we know from the limited research is that the estrogen androgen receptors that are being activated are not systemically bringing a measurable amount of estrogen androgen throughout the rest of your body. Like, it's just staying in that area. So it is worth talking to your doctor about, could this be an option for you? Another option, which is similar, is ospemifene. It's a pill. It's a SERM. It's a selective androgen modulator receptor that acts similar to estrogen on the upper layers of the skin, on the epithelium. It is FDA approved for sexual pain for vaginal dryness, but it is not yet approved for those with breast cancer. So I give you all of these warnings. It's at least worth a conversation with your doctor. Then there's vaginal lasers. Many of you have probably heard of vaginal lasers. I was talking to someone earlier who's tried a vaginal laser. Let me tell you about vaginal lasers. This is my rudimentary, non-medical way of describing how they work. They essentially injure the tissues to encourage healing healthier tissues. So that's a laser inside a vagina right there, and it's like all these little microcuts, with the idea being that when your tissue grows back, it grows back healthier. I see like a lot of mouths open. So in 2021, there was a study that compared women, 85 women, half of which who took the laser, the legit laser, and half did a fake laser. And women didn't know which laser they were doing. And then they tested women to see, okay, for those who did the fake laser versus the real laser, who got better? And what they found is there was no difference. There was no difference between the women who did a fake laser and the women who did a real laser. As a result of this, the FDA says the risks of this are more could potentially be more adverse than we know. And since there's no difference between fake laser and real laser, this may not be worth your time and money. Okay, here's the take home on sexual pain. Sexual pain is caused by treatment-induced menopause. If you are having sexual pain, stop. Number one step, stop having painful sex. Number two, are there any over-the-counter options that can alleviate that pain, like moisturizers, lubricants, a new sexual menu, maybe accessorizing with sexual aids? And then step three is to talk to your oncologist about prescription options, because there may be some options that you didn't realize are actually options for you. Okay, now we're gonna go to poor body image, and this takes us back to Kelly. And Kelly says, I can't even look at my breasts, let alone let my wife look. I haven't let her touch me since my surgery. So let's talk a little bit about breast cancer and body image. You know this, it is hard to want to be sexual if you don't feel sexy. This was said a little bit earlier, that if you don't think your partner is gonna find you attractive or your breasts attractive, it's gonna be distracting, it's gonna be difficult to wanna be sexual with your partner. All those negative thoughts are very distracting. They take you out of your body, they take you out of your sensations. There is a ton of research on mindfulness as a treatment for this issue. If any of these things that I mentioned, where you feel like, I don't feel sexy, is my partner not gonna think that I'm sexy, I can't even get present in my body, if any of those things are true for you, I want you to really think about mindfulness. So let's talk about mindfulness. Mindfulness is being fully present. It's a practice where you work on being fully present in the moment without judgment. It is also called sometimes a non-reactive awareness. So just imagine you're in the moment and you're just focused on sensations, and maybe a distracting thought comes in, like, oh, the kids are gonna come in the room, and you just see that thought, and you let it go by, whoops, you wave it by, and then you just get right back to your sensations. So yeah, your mind is not blank. You're absolutely gonna have thoughts coming in, but it's all about just non-reactively seeing those thoughts, noticing them, waving goodbye to them, and then getting right back into your body. So that's essentially mindfulness. There have been a dozen clinical trials showing the impact of mindfulness for women, and mindfulness for women with breast cancer specifically. And what we've seen is that women who use mindfulness with their sexual experiences with their bodies have improved sexual desire, improved sexual arousal, and even a reduction in sexual pain. So mindfulness is a phenomenal tool to improve your sexual function and get reconnected with your body. You can do mindfulness solo or with a partner. It is free. You can do it at any time. And what I recommend when I work with my clients is, first, if you're new to mindfulness, if you've never done it before, I've only done it just a little bit, I recommend starting it non-sexually first, and that's what we're actually gonna do for a moment. And then, so start it non-sexually and then eventually start it sexually. I'm gonna walk you through how to do all this. So we're gonna do a 5-minute mindfulness exercise right now, and that's why I asked all of you to save one bite of food. A lot of you, okay, hopefully, yep, I see some food, some crumbs. There's candy in the bags? Oh, excellent, so candy in the bags. So if all of you can grab your one bite or your piece of candy, whatever it might be, I'll give you a moment to grab that. And while you're grabbing this thing, this bite or this candy, I want you to, and this is one of the core elements of mindfulness, I want you to imagine that whatever this thing is, you have no idea what it is. We call this in mindfulness a beginner's mind. You don't know what this is. So if you're looking at this and you're like, yeah, it's hard candy. Like, nope, imagine you're an alien that just came to this planet. You don't know what this is. So if everyone's got their item, and for some of you it's going to be a little more difficult than others, like I'm noticing that on your fork, but it'll be fun. You might have to wash your hands afterward. I want you to take this item, and you absolutely can do that dessert, but I want you to put it on the palm of your hand. So take the item you have and place it on the palm of your hand. And I'll do it with this is the cap of my water bottle, but I'm an alien, I don't know what this is. I'm gonna place it on the palm of my hand. So put it on the palm of your hand, and I just want you to simply observe it. So take a look at it. Take a look at it. Look at all the different angles. I mean, does it reflect differently in the light? So just look at this object on the palm of your hand. And really notice it. I mean, so notice, like, what do you see? I don't know, what do you smell? You can smell it. Maybe put it close to your ears. Like, can you hear anything? And I want you to really describe, like, in your mind, the color, the texture of it. You can even think about, like, what's the weight of it on your hand? And a core piece of mindfulness is there is no judgment. So let's say you have this on your hand. And so again, I have the cap of my water bottle, and I might think like, oh, my mind might start to go to, how many water bottles are in the ocean and polluting? I'm like, no, just let that thought go by and get right back to, okay, this is kind of circular, it's a little rough around the edges. So you're just genuinely trying to describe it without any judgment, just the facts, just the facts. It's hard. When I push on it, it doesn't really flex. So just factually what you're noticing. So describe that in your mind. Now, and I just started to do this, I want you with your finger to start to touch it, move it around, and notice everything that you feel as you touch it. Is it rough or is it smooth? Is it hard or soft? Is it warm or cool? You know, as you can pick it up too. Do you notice if you flip it around, are there different colors on different sides? Does the color play off the light? What's the weight of it in your fingers? And then when you're ready, I do want you to pick it up, and I want you to place it next to your nostril, just one nostril, and just smell it. And really notice beginning, middle, end of the smell, and then switch it to the next nostril, beginning, middle, end of the smell. What do you smell? And try to really describe the smell without any sort of judgment. What is that scent? What's the aroma? Does it get strong? Does it like start off stronger and then get a little fainter? Just describe this. And then next, I want you to take the object, and I want you to put it next to your ear and just roll it between your fingers. And take your time and really notice the sound of this object. And roll it around in your fingers, and when you're ready, switch it to the next ear and roll it around in your fingers. Okay, and then next, I want you to take this object and just place it against your lips and kind of rub it on your lips. Just what sensations do you notice? Just describe the facts. And you might notice some thoughts. Maybe you're thinking like, oh, I really want to eat this. Or I really don't want to eat this. But just, okay, just let that thought go by and get right back to the sensations. Do you notice any saliva building up in your mouth? And now I want you to place the item on your tongue and just hold it there. So don't chew anything, just on your tongue and hold it there, and just notice the taste of it. The taste, the texture, notice any salivation, any thoughts of wanting to chew or wanting to swallow. So right now it's just resting on your tongue. Just notice all those sensations. Okay, and then when you're ready, move it in between your teeth. Don't bite down on it. So just place it in between your teeth. Don't bite down. And I know you've got like the entire dessert right there, so you might just want to do a bite because I don't. So place that in between your teeth and just hold it there. Notice texture, any taste. Are you noticing saliva? Any thoughts of wanting to chew or swallow the item? And you can just notice those thoughts and get right back to, what are the sensations? What's the taste? Now, slowly start to chew the item. Don't swallow yet, just slowly start to chew it. Notice the flavor. Does the flavor kind of shoot forth as you chew it? Does it linger? What's going on with the saliva in your mouth? Feel like the muscles in your jaw as you bite down. Just notice any sensations, notice any flavors. And then when you're ready, slowly start to swallow the item and really feel it. Feel it go down your throat. Notice kind of the beginning, middle, and end. You might need some water at this table. But yeah, notice as you're swallowing that feeling, that sensation down your throat, any saliva that you're noticing. And then when you're ready, kind of come back into the room. Now, what was that like for everyone? Specifically, I've got a question though. How was this like how you typically eat? People are shaking their heads, not. Yeah, what are your thoughts? Share. Really slow. So yeah, really slow. You're like, speed it up, speed it up. Yep. Ooh, anticipatory. So you had some thoughts. Yep. Saliva was kicking on as soon as you smelled the food. Yep. I know for me, this is not how I typically eat. Like I can grab a bag of chips and be like 10 chips in before I realize I've had that many chips, like just being so not mindful. So that, I had a timer on my watch. You just spent 5 full minutes with that one bite. That was 5 minutes on one bite. Okay, so now let's tie this back into sex. How do you think how you ate this food right now, this 5-minute mindfulness practice, how do you think this is relevant to your physical sexual relationship with yourself and or with your partner? Like, why would we possibly be doing this? Why does this relate to sexual health? How? So the kickoff is the physical. That responsive desire? Mm-hmm. Ooh, yeah. So if your main desire is that responsive desire, things got to get kick-started. If an exercise like this that slows things down, allows you to tap into sensations is anticipatory, that can help kickstart that responsive desire. What else? How else might this relate? Yes, more than one sense. Yes. So thinking about not being distracted with negative thoughts about your body image, what your partner's thinking about your body. If you want to just be in the moment, tap into all 5 of those senses the same way you did with this piece of food, but you tap into those senses of your body. So you might be having this thought of like, oh my gosh, what does my partner think of my breasts right now? And then you just say goodbye to that thought, and you get right back into temperature, pressure, texture, smell, maybe there's taste. Get back into those senses. Try to get back in your body, out of your head, and back in your body. So that's absolutely how it relates. It helps you get more present with yourself and your sensations. And your sensations will have changed. So you may say, like we were talking before about nipple sensation, you might think if your partner's touching your breasts, like, I don't feel anything. This just feels numb. And that's going to start to distract your mind. When you use mindfulness, you say, okay, I noticed that thought. I'm going to say goodbye to that thought. I'm going to get back to what I do notice. Okay, I notice it's kind of cold. This feels a little bit heavy. And you're just going to get back to describing. And here's a powerful piece about mindfulness. You know, a lot of times when people talk about body image, wanting to feel better about your body image, they say, body positivity, like hearts and rainbows. That's lovely. But if we think about this as a continuum, if you're over here and have so much body negativity, and you're trying to get to this body positivity piece, you got to get to the center first, neutral. And mindfulness is helping you get to neutral. So instead of saying all these negative things about your body, you're just being neutral about your body. And that is a great, great step to not be just filled with all this negativity. Was there a hand? Or yes, yeah.
Okay, so what if you, this is a little hard for me because
Yeah.
me and my partner both have untreated ADHD.
Yeah. Oh, yeah. Mm-hmm.
Things for us aren't like, for me, it's like, I don't want to take another pill. For him, he's been untreated for the last 10 years.
Mm-hmm.
Because he was on medication. So the mindfulness of things, I could take about a minute to do mindful things, and then I'm like,
Yep. So what do you do if you have untreated ADHD? Oh, and on top of that, your partner has untreated ADHD, and then you see a squirrel, and then you're just like, it's gone. One, consider treatment for the ADHD, but that's No, just thought on that. Two would be, it may just be little mindful spurts. So the exercises I'm going to talk about a little bit later or soon are like 30-minute mindfulness exercises. For you, it sounds like that is not going to be happening. There is an app, which I'll talk about in a moment, called Headspace, and you can get it for free for a week, but it is little tiny mindfulness games. So what I would recommend is try these little tiny mindfulness games just throughout the day and see, are you able to build your capacity from a minute to maybe 2 minutes, maybe 3 minutes? And maybe it's only going to be for you a handful of minutes in the end, but a handful of minutes of being totally present with your body, with your partner, is better than no minutes. It's just a place to start. Okay, so we're going to do another exercise. You do not need any sort of food for this one. We're actually going to take what you just learned with the food, and we're going to bring it to your body. So this is going to be about an 8-minute body scan. So what I want you all to do is get into a comfortable sitting position. And when I say comfortable, ideally your feet are flat on the ground, your legs are uncrossed, and your back is upright. Maybe your spine, head and neck are kind of in alignment, but I don't want you to feel like you have to be too stiff. So just a comfortable sitting position. And your hands are maybe resting on your thighs or on your laps. And just, if you feel comfortable, allow your eyes to close, if that feels comfortable. If that does not feel comfortable, keep them open, but if you have them open, just have them have like a downward, unfocused, soft gaze. And I want you, as we're going through this exercise, I'm just going to give you a few instructions before we get started. I want you to just do the best you can to stay alert, stay mentally focused throughout this scan. What we're going to be doing is you're going to be becoming aware of whatever sensations are present in the different parts of your body in each moment, and just bringing an accepting attitude towards whatever is arising in your field of awareness. Just looking at it clearly, seeing it as it is, and letting go the tendency of wanting it to be different. So whatever comes in your field of awareness, just to allow it to be as it is right now without trying to change it in any way. Allow yourself to be exactly as you are. No goal of changing what you're experiencing. And try to follow these instructions the best you can. I'm going to ask you to be placing attention to different parts of your body. And whenever you notice that you're not paying attention to the sensations, or maybe you're not noticing your breath, just congratulate yourself that you're aware that you noticed that, and then just refocus and try to get your attention back to your breath, back to those sensations. There are no correct sensations that you're going to be experiencing. Just whatever you notice, you get to notice. Whatever you notice, you get to notice. Okay, so I want you to start by bringing attention to the sensations of contact between your body and the chair and the floor. So all those places where the body is supported as you sit, notice those sensations. Are there sensations of touch or pressure, maybe temperature, maybe texture? Just notice those sensations of contact between your body and the chair. And then slowly bring your attention to the sensations of breathing. Do not manipulate your breath in any way. Just allow it to be as it is. Don't try to make it slower or deeper, but just experience the sensations of breathing as the air moves in and out of your body. And direct your attention in particular to the abdomen, really just feeling the sensations in that region as the breath comes into the body and the abdomen expands gently, and as the breath moves out of the body and the belly deflates. Just allowing attention to rest on the sensations of breathing from moment to moment, following those rhythmic movements of the belly with each breath, the rising of the belly on the in-breath, falling on the out-breath. Now over these next few breaths, gather your attention and really move your focus toward your right hip and your left hip and the whole entire area of the pelvis. So from one hip to the other. And really notice sensations in the pelvis, the lower abdomen, the buttocks, the genitals. Notice sensations of contact with the chair or the thighs. Just become aware of the region of the genitals, sensations of warmth or weight, mild or intense, whatever is there in this moment. And really noticing if the sensations are accompanied by a feeling of pleasant, unpleasant, neutral. Notice the thoughts as they arise, and as best you can, just simply allow even the judgmental or critical thoughts to just be there without reacting to them. And then you can just gently say goodbye to them and get right back to the sensations, right back to those physical sensations of the pelvis. And then when you're ready, release attention from the pelvis and move attention to the lower back. Just noticing any sensations of contact with the chair, any subtle movements in the lower back associated with breathing, noticing any sensations of tightness or tension, and just allowing yourself to feel whatever sensations are there, just experiencing the sensations in the lower back as they arise, linger, and move on. And then when you're ready, releasing attention from the lower back and moving attention to the abdomen, experiencing that rising and falling of the belly as you breathe, and just allowing the awareness to expand from the belly up to the chest as well. Feeling the movements of the diaphragm, that's that umbrella, the muscle that separates the belly from the chest, heart, and lungs, and just experiencing the chest as it expands and contracts on the out-breath. Noticing any sensations associated with the rhythmic beating of your heart within the chest. So just experiencing the chest and belly, the entirety of the front body. You may be having some thoughts. Just let those thoughts go by and just get right back to the sensations of the chest and the belly. And then when you're ready, releasing attention from the front of the body and moving around to the upper back and shoulders. And just feeling the sensations in this region, the rib cage expanding on the in-breath and contracting on the out-breath. Noticing any sensations comprising of tension or relaxation, tightness or ease in the upper back and shoulders. Notice any associated feelings of liking or disliking these sensations, either wishing they would stay or wishing they would go. Just notice those thoughts. Bring a gentle acceptance to them. Allow them to linger and then move on. And then when you're ready, releasing attention from the upper back and shoulders and moving up to the neck. So the back of the neck, the throat, maybe even experiencing some of those sensations of swallowing and breathing. And then when you're ready, release attention from the neck and move up to the lower face. So bring attention to the jaw and the chin, the lips and the mouth, the teeth and the gums, the tongue, the roof of the mouth, the back of the mouth and throat. Just expanding your awareness up the whole face, include the upper lip, the nose, the cheeks, the eyes, the eyelids, your eyebrows, that space between the eyebrows, the temples, the forehead. Just allow your attention to rest on your entire face. And then when you're ready, release attention from your face and move to the top of the head, the back, the sides of the head, include the ears, like the entire cranium and the space inside the head. And then when you're ready, releasing attention from the head and just expanding your awareness to the entire body. So from the top of the head to the bottoms of the feet, paying careful attention to the many individual sensations that arise and pass away within this larger field of awareness, wherever they may be located in the body. And just allowing attention to move fluidly from sensation to sensation, wherever they're arising in the body, just momentarily focusing on each one as it rises and fades, just observing it as clearly as possible, not trying to change it. And then as we come to the end of this practice, you might want to wiggle your toes, your fingers, just kind of notice those sensations of movement. And remember that this state of awareness is accessible to you by simply attending to sensations, such as those in the in-breath or the out-breath, in any moment, no matter what is happening at any time of the day. And so whenever you're ready, if your eyes were closed, just allow them to open up, or shift your focus just back from the sensations in your body back to the room. Okay, so let's just take a minute or so. What was this experience like? Does anyone want to share? Painful. Yeah, because you can feel the pain. When you felt that pain, were you able to describe it? Like, this feels like a sting or a burn, or... Yeah, it was hard to even think about it. So one of the things with mindfulness, when you feel... So pain has a judgment to it. Mindfulness is about trying to take away that judgment and just describe it factually. So if you were to describe that pain, how would you describe it? Just the facts, just the sensations. It feels tense, it feels tight. And not that that takes away the pain, but it puts you in a mindset where you're more neutral toward it. It is tenseness, it is tightness, versus it is pain. Not saying it feels any better to do that, but it just starts to shift your mindset more to the neutral. it starts to give you a different relationship with your body. So imagine, what we know from the research is that doing mindfulness, let me get this back, 20 minutes a day, doing an exercise just like this. We only did this for 5 minutes. Doing an exercise like this for 20, actually we did it for 8 minutes. For 20 minutes a day is where you get your maximum benefit, because you start to change the way you talk about your pain, the way you talk about your relationship with your body. And it's not hearts and rainbows, but it shifts from negativity toward your body, at least to neutrality. And that then allows you to tap into things that you maybe weren't able to tap into before when you were in this negative space. Other experiences of this? Yeah. So it reminded you of the aqua therapy, because your therapist is like, feel that pain, feel those sensations, figure out where they are in your body, acknowledge them. Yeah. It calmed you down. True, it calmed you down and you were trying not to fall asleep. Yes, sometimes I do mindfulness and I end up falling asleep. Yeah, yeah. Yeah, a chance to reset. Yeah, to try to take those negative thoughts, see them, not put energy toward them, see them, wave high, wave by, and then get back to this place of neutrality, of neutral with your body. Now, there are exercises called sensate focus exercises that I alluded to a little bit earlier, and these are mindfulness-based partner exercises. We'll talk about them in a moment, but if you found these mindfulness exercises helpful, then I'd really highly recommend this, not so much the book. So the book is Better Sex Through Mindfulness, but there's a workbook. And I would say just get the workbook. The book is a little bit hard to read because it's very research-based, but the workbook is really helpful. It'll give you daily exercises to build this mindfulness muscle. And the woman who wrote this book, Dr. Lori Brotto, she is the one who has done those dozens of clinical trials. She is the psychologist who has done these clinical trials. She's the one that wrote the book, and she has done most of these clinical trials with cancer survivors. I had mentioned a little bit before about Headspace. So the guy who started Headspace, his name is Andy Puttycombe, and he has a really great 10-minute TED Talk on mindfulness. So if you just want to learn more about this concept, you can watch this 10-minute TED Talk. And then here's the website he developed, headspace.com. I believe you have to pay for it, but the first week is free, and you get 7 days of just trying these little mindfulness games, just moments of mindfulness to start to build that mindfulness muscle. Okay, the last thing we're going to talk about, and Sean, how are we doing on time? What do I have? 20 minutes? Okay, great. I can take my sweet time with this last one. So this last one is the avoidant sexual dynamic. So I talked before about the avoidant sexual dynamic. Let me add a little bit more to this avoidant sexual dynamic. So I mentioned before, it starts with sex stops. Then it ripples to the non-sexual physical affection stops, and then if it ripples even longer, this is where a couple says that their emotional connection has stopped, and they say, we just feel like roommates. This is the most common dynamic I see with the couples that I work with. The other two dynamics, one is called the hostile dynamic. So with this one partner says, you want to have sex? And the other partner says, no, thank you. And then this partner says, well, too bad. We're married, and so we have to do this. Or, if you loved me, you would. So this person gets hostile. And as you can imagine, incredibly damaging for a relationship. And then the third dynamic, and this is the dynamic that I try to help couples get to. In the research world, it's called the facilitative dynamic, but I just like to call it the teammate dynamic. So here's what this third one looks like. It starts off kind of looking like the avoidant dynamic. So one partner says, do you want to have sex? And the other partner says, this hurts. Hold on, I gotta wake up my laptop. One moment. So one partner says, want to have sex? The other partner says, no, this hurts. In the avoidant dynamic, then that partner just says, okay, well, I'm not gonna initiate anymore. You just let me know. But in the teammate dynamic, it then becomes a discussion of, okay, well, if this hurts for you, I still want to be intimate. I still want to stay connected. How can we connect in a way where this isn't painful? How can we put our heads together as teammates and figure out what's going to work for both of us? That's the teammate dynamic. That's where you have a discussion. You're really trying to figure out what's going to work for both of you versus just avoiding because it's uncomfortable. So that's where I'm hoping to get my couples to, this facilitative dynamic. All right. So the avoidant dynamic, before we can even talk about how you manage the avoidant dynamic, and hold on, my computer just decided to midway through this, take a dump. So let me get back here. Okay, so before we can even talk about how you navigate the avoidant dynamic, I need to go back to the sexual response cycle. So I mentioned this before, the sexual response cycle. You and your partner, let me go back here, may have response cycles that differ. And if you have response cycles that differ, it's going to be more complicated to navigate your sexual relationship. So what does that mean when I say they might differ? Now, I discussed this before. I'll give you kind of a brief synopsis with it again. For most of you in this audience, your main desire is probably going to be that responsive desire. The main way you get into your sexuality is probably going to be this circular model, which means that you're going to be responsive. There's some sort of stimuli. Maybe that's the partner initiating. Maybe that's something sexy on television. As long as all these systems are in check, first your body has to get aroused. Then your mind says, oh yeah, okay, I'm kind of into this. Yeah, we should do this more often. That leads you to feel some sort of emotional and physical satisfaction, and that leads you to feel close and connected, either with your partner or with yourself, really. This emotional intimacy could be with your partner or with yourself. So most of you, again, in this audience, this is the way your sexual response is going to work. But you might have a partner where this is their sexual response cycle. And this is called the linear model. So here's how this one works. It starts with desire. So it basically just starts with that spontaneous desire. Your partner's like, hey, I want to have sex right now. Leads to arousal, leads to orgasm, and then that leads to the resolution phase, which is what I just call cuddle time. And just a side note, you see 3 different lines here. Those are the 3 different types of orgasm. So for some people, it's one big roller coaster of an orgasm. For other people, it's multiple orgasms. For some people, it's like one just long, tiny, tiny little roller coaster. Not totally relevant to this, but I just wanted to explain those lines. So your partner might be someone who says that their desire kickstarts with just simply having spontaneous desire. That might be the partner who says, hey, you want to have sex right now? Because that's like how it gets started for them. Ooh, talk got real exciting. So if your sexual response cycle differs from your partner may not understand responsive desire. So many times I work with couples, and the partner that has the spontaneous desire thinks to the responsive partner, you don't find me attractive. You must not be interested in me. If you don't want to just spontaneously have sex, then I guess you're not into this. So we have lots of discussion about, wait a second, spontaneous and responsive desire, they're equal here. They're different, but they're equal. And just because this one you need ingredients doesn't mean it's any less valuable than the other one. It doesn't mean your partner is not attracted to you. So simply having this conversation, your partner understanding responsive desire, could be really helpful in getting you back on track to a sexual relationship that will work for both of you. So talk to your partner about the ingredients you need to have in place in order to be responsive. And we know that emotional intimacy is one of those key ingredients. Know that your cycle is probably going to kickstart with arousal. So that simple question of do you want to have sex isn't going to cut it for you. Your cycle needs to kickstart with arousal. There needs to be some sort of touch or something to get your body aroused, where your partner's spontaneous desire doesn't need that arousal to kickstart it. Your partner's just going to spontaneously want to have sex. Now, what if, you might say, Jordan, this is all lovely. Yes, it's so great learning about our different response cycles, but we're in an avoidant dynamic. How do we do this? Okay, so what if you are in that avoidant dynamic? This is where these sensate focus exercises that I keep mentioning come into play. Sensate focus exercises are one of the key tools that I teach couples in therapy who are trying to just rebuild or create a new sexual relationship. These are touching exercises where there is no demand, there is no pressure, there is no sex. So you two agree that you are going to do these touching exercises, but no one is initiating sex. Sex is off the table. So let me give you some of the basics of these, and then I'll explain why no sex is so important. So these are touching exercises, let me get back here, in a private space. You do them for 20 to 30 minutes. It's full body touch with your partner. You are nude to whatever extent feels comfortable. So if you're in a place where you don't feel comfortable showing your chest, well, then you can wear a bra, wear a t-shirt. No sexual activity is allowed during these exercises. You do them every 48 to 72 hours if possible. Most of my couples that I work with can't possibly do them that frequently because just life is busy, so at least once a week. And there are phases that build on each other. Okay, so let me talk more about these. Again, 20 to 30 minutes, or whatever time is meaningful. So like the discussion earlier, if both you and your partner have ADHD, 20 to 30 minutes is gonna be way too much. Maybe it's just a solid 5 minutes. So you set aside this time, you have privacy, and you are fully nude or nude, whoever extent is comfortable, and you are touching your partner all over, and they are touching you all over, and you agree no sex, and that is so important, because if you think this is going to turn into sex, what do you think is going to happen? Yeah, you're not going to want to do it because you think, oh, well, this is just foreplay to sex, or it's going to hurt. This is going to be painful. So you both have agreed to the rules. There is no sex. This is just touching, just touching. Now, as you're touching, again, full body touching, in phase 1, and there are 10 phases to this. So in phase 1, there is no touching of breast, chest, or genitals. Those are off limits. Those are off limits for a few reasons. One, those are traditionally the erogenous zones, and we're really trying to set these exercises up to not be sexual. But 2, you may not feel comfortable having your partner see your breasts, chest, touch. So let's just take them off limits from the beginning. Let's get you working on being more comfortable, at least more neutral with your body, with your partner. So again, no sex, and they're nonverbal. So you're not talking during these exercises. These are mindfulness exercises. So think about what you did with the eating exercise. Think about what you did with just the body scan, and take this into these couples exercises. It's the same thing. You are tapping into sensations. That's why they're called sensate focus. You are focusing on sensations the same way you did with the food, the same way you did with your body. Now you're doing it with your partner. In this phase, you take turns. So let's say you decide to do this phase for 20 minutes. So for 10 minutes, you're going to touch your partner all over their body, and then you say switch, and for 10 minutes, your partner's going to touch you all over your body. Hands and fingers only. I have lots of couples that try to get crafty, and they're like, can we touch with our tongue? Like, nope. Hands and fingers only. And now here's such an important piece, and this is a core component of how these are mindfulness exercises. You are touching for yourself. So let me explain this. As you are touching your partner, you are attending to what you're feeling. What are the sensations on your fingertips? You are not touching your partner to please your partner. Because if you think, oh, I'm just trying to figure out what feels good for them and what they might like, now all of a sudden you've added pressure. Pressure that you're supposed to be touching in a certain way, or you're supposed to be performing in a certain way, or supposed to be figuring out what feels good for your partner. No. These are no pressure, no demand, no expectation. You get to touch how you want to touch, and you pay attention to how that touch feels for you. So as you're touching, you're focusing on temperature. So imagine you're touching your partner. Is this warm? Is this cool? Pressure. Is this firm? Is this pressure? Supple. Yeah, firm, supple. Texture, rough, smooth. TPT, temperature, pressure, texture. Think about it. This is the same thing you were doing with the food. It's the same thing you were doing with your body as you were noticing the contact between the chair and your feet. You were just focusing on sensations. So imagine you're touching your partner, TPT, temperature, pressure, texture. And these sensations in particular are most helpful to focus on because they capture your immediate attention. They're always there. TPT, temperature, pressure, texture, they're always sensations that are available. So you're touching your partner, and you're just touching how you want to touch and focusing on what your fingertips feel, on what you feel. You are not trying to please your partner. And you're not talking. So the hope is that your partner will tell you. You can trust your partner to tell you if anything is painful in any way. But if you don't hear them say a word, then you can trust that, okay, you just get to continue to touch and all is well. If something is physically uncomfortable for them or hurts for them, they'll take your hand and move it, or they'll verbally tell you to move your hand. But other than that, you can just trust that you just get to explore and touch the way you want to touch. And when you switch, your partner's going to do the same for you. They're going to touch the way they want to touch, temperature, pressure, texture. But if something is physically uncomfortable, you can tell them or take their hand and move it. Now okay, so let's see. The basics of phase 2, all body parts are on limits. So instead of breast, chest, genitals being off limits, when you're ready to go to phase 2, now the entire body is on limits. Again, there is no sex. Again, it's nonverbal. We got full body touching. You also take turns, hands and fingers only, touch for yourself. So all the same rules, but in the previous phase, breast, chest, genitals off limits. But in this phase, entire body on limits. And you know you're ready to move to the next phase when 2 things happen. So if you've been doing several phase 1, and usually I'll tell couples, do a phase 1, do it at least 3 times, but do it longer if you want. But do it until 2 things happen. 1, you both feel like you're really able to get into that mindfulness zone, that when you're doing the exercise, yeah, a distracting thought comes in, but you're able to wave goodbye to that thought and refocus and get right back to temperature, pressure, texture. So when you're able to be in that mindfulness zone, and then 2, when you're kind of bored, when those two things happen for both of you, then you know you can have a discussion with your partner and say, hey, are you ready to go to the next phase? Then you go to the next phase. So again, this phase, basically identical from the first, except for all body parts are on limits. And I mean, this is big because now chest, breasts are on limits. So you might be getting triggered. There might be more difficult thoughts coming through your mind. You really need to be practicing that mindfulness, mindful eating, mindful exercises throughout the week non-sexually to build that mindfulness muscle. So when you get to this phase 2 and your partner is touching your chest or your breasts, those thoughts come in and you're able to really kind of refocus and just get back to temperature, pressure, texture, temperature, pressure, texture. Yeah, question. Focusing on TPT, yep. Ooh, good question. Like, so yeah, if you're being touched, what are you focusing on? If you're the toucher, what are you focusing on? You're both focusing on TPT. So if you're being touched, your partner's touching your body all over, you're focusing on temperature. I mean, your partner's hands may be warmer, cooler, parts of your body may be warmer, cooler as they touch. You're focusing on the pressure that they're touching you. Maybe like part of their hand is a little bit rough or they touch with an area that there's a hangnail and you're like, oh, it's a little bit sharp. But so just, yeah, TPT, when your partner touches you, you're both focusing on that, whether you're the toucher or being touched. Great question. So phase 3 is the same as phase 1. So phase 1, breast, chest, genitals were off limits. All the rules are the same, except instead of taking turns touching, you do 10 minutes and then switch and do another 10 minutes, you're simultaneously touching. So that adds some more stimulation because now both at the same time you're touching. So there's a lot of TPT happening. And then phase 4 is the same as phase 2. All body parts are on limits, but instead of taking turns touching, you're simultaneously touching. So each of these phases are just tiny little additions, and you don't go to the next phase until you're in that mindfulness zone and you're both a little bit bored. And when you're there, then okay, go to the next phase. And this is not a race to the end. What is most impactful about these Sensate focus exercises is not, yeah, we got to phase 10, we did it. It is more about the actual exercise and experiencing it and less about getting to the next phase. I work with couples that never get past phase 4, and yet they still meet all of their goals. Because what they're learning and experiencing during the exercises, the journey, is so much more important than trying to race to the end. Yeah.
So is there like a step before, step 1? Like, I usually feel understood and validated before I even
Ooh, okay, wow, this gets into okay, I want to answer this. How much time do we have now, Sean? Oh, it's okay. 10 minutes. Okay, great. Yes, I want to answer this in more entirety then. So your question was, is there like a phase before phase 1 because I need to be heard and validated and understood before I do any of this? That is such a good point. So I'll go into a little bit of a spiel that will answer this, I promise. As a couple, so I'm a sex therapist, couples therapist. I only see couples for whom their primary concern is related to sexual health. And I will tell couples that when we create your treatment plan, more than likely, it is going to be a while. It's going to be maybe 5, 6, 7 sessions, maybe even longer before we even get to sex. There are often a lot of other things that need to be worked on before we can get to sex. Because what we know from the research, I mean, I see this in my couples all the time, you need to have a foundation of trust, a foundation of respect, and a foundation of a friendship. Trust, respect, and friendship is like the trifecta that you need before you feel like you can even do something like Sensate Focus or have a vulnerable sexual relationship. So oftentimes in couples therapy, I'm doing all the non-sexy stuff, all the trust building, communication, respect stuff before we even get to sex. So back to your question, is there like an earlier phase 1? Yeah, if you feel like that trifecta, the trust, the respect, and friendship isn't fully there or that needs to be worked on more, then I would say like doing some couples therapy. And then when that's there, then thinking about adding in the Sensate Focus or the physical piece. But if we go back even to that circular response model, a core component for that circle to go is having that emotional intimacy. And if you're not feeling that emotional intimacy, that's a huge break in your cycle. Great question. Did that answer it? Okay. And maybe I want to give you one more tiny little answer. For some people, full body touching, so phase 1, fully nude, full body touching, that is like, whoa, that is way too much. So put on clothes, have some level of clothing. You could be fully clothed. It's more important that you feel comfortable. I have some couples that say, I don't even want my full body touched. And so then we'll do a Sensate Focus, we'll modify it and say, okay, what feels comfortable being touched? Okay, just your arms? Great, we're gonna follow all the sensate focus rules, but it's just gonna be touching of the arms, or just touching of the lower body, or just touching of the legs. So you can take as long as you're doing the core principles of no pressure, no demand, temperature, pressure, texture, you can choose whatever parts of the body that you wanna try this with. I have couples who just start with hands. They will just do a sensate focus of each other's hands, and then we go from there, and then we get to wrists, and then get to arms. So you can take this as slow as you need to take this. This is on my website. You can download these exercises, not all 10 phases, but the phases that we've talked about you can download. So just my name /sensate focus. There is a book on how to do these exercises. The book is written primarily for therapists, so it's a little bit hard to follow, but if you, like even as a therapist, I have a hard time following the book, but if you really are like, nope, I want to get the nitty-gritty details, I would recommend getting that book. It's Sensate Focus in Sex Therapy. Okay, so here's the take-home on the sexual relationship. Your sexual responses may differ between you and your partner. You may have the circular response, which means you need arousal to kickstart things, and your partner may not have that. Emotional intimacy is a necessary ingredient for these cycles, for the circular cycle to continue to circle. And if you're in an avoidant dynamic, really think about sensate focus as a way to break this dynamic. If that doesn't feel like it's going to be enough, consider sex therapy. There are 2 major organizations for sex therapy. The first bullet point is really the biggest organization. It's called ASECT, the American Association for Sex Educators, Counselors, and Therapists. So I would recommend go to ASECT. You can search by your state and find local sex therapists. Every sex therapist knows how to do sensate focus. These are mainstays of our sex therapy practice. And then ISHWISH is also a good place. You can find more medical providers, less sex therapists, but it's still a good option to check out. And then overall take-home message of this entire presentation, breast cancer does not take away your sexuality. Maximize your responsivity by finding what the right ingredients are for you and then share those ingredients with your partner. If you are having painful sex, stop. Try moisturizers, lubricants, maybe a non-penetrative sexual menu, or even talk to your doctor about the possibility of some prescription options for GSM. And then finally, if you're in that avoidant dynamic, really consider sensate focus, and if you need something a little more advanced, consider sex therapy. And thank you so much.